Hello, everyone, and welcome to today's webinar. This is part 2 on the Biden orders for federal vaccine mandates. So a few weeks ago, we unpacked the original mandate that came from the Biden administration. But as most of you probably know, whether you were able to join that session or not, we've been waiting patiently for weeks for guidance from OSHA to really talk, to lay out the implementation rules. So I think we all understood the basics of what size companies were going to be impacted, what the expectations of companies were going to be. But there were just so many unanswered questions that we've been kind of sitting on pins and needles waiting for that guidance, and that guidance has finally arrived. In joining me today, I can't think of a more qualified person to help us unpack this OSHA guidance. And you've met her before in these webinars. Mary Simmons, she's our VP of HR Consulting. Mary not only is that leads the consulting practice, the HR consulting practice for sure. She's also for the last years an adjunct professor for New York Institute of Technology. And prior to Assure, she's held just a lot of really prestigious roles, including most recently 11 years leading the HR practice for a New York based law firm, Portney Messenger Pearl and Associates. She's been a career counselor at Lee Harrison and started her career, spent 16 years in HR in various roles at the Bank of New York. So a really great human being, and you couldn't ask for a more expert opinion to unpack this information. Welcome today, Mary.
Thanks, Mike. Thank you so much.
Okay, so I want to spend maybe just 60 seconds here, Mary. Can you just kind of recap, what was in the Biden executive order? We're going back a couple months already here. This happened on September 9th,
Right.
But where we kind of thought we were going to get DOL, OSHA guidance on the rules to implement a little sooner. It's taken longer than expected, but we're finally here. So since so much time has passed, maybe just 30, 60 seconds on what the executive order is.
Right. So, we start with vaccinating the unvaccinated. So obviously that's the precipitous for the entire plan. And along with that, obviously comes protecting the vaccinated, keeping schools safely open, increasing the testing and requiring masking. Hoping that all of this will help the economic recovery and improving the care for those with COVID-19. So those were the overriding factors creating this plan. And then as we unpack today, some things have been added since we talked in September, and we'll go through those in detail.
So the only thing I want to say, I'll kind of give our little warning ahead of time here. We do our very, very best to not make this political at all. We totally understand many of these issues, frankly, are polarizing, right? These mandates, some people love them, some people hate them. We are not taking a stand on how we feel about it. If we do our job, you'll have no idea what Mary's and I's political leanings are. All Assure cares about is advocating for small businesses and mid-sized companies. So our job today is to unpack the law, right? And unpack the mandates, help you understand what is required of you, whether you like it or hate it, so that you can best run your business, so that you can create a safe work environment that follows the law, and ultimately grow your company by building a great team. So there's our disclaimer. No hate mail. If you don't like what we have to say, literally all we're doing is unpacking the legal guidance, the rules of the road, if you will, that came from OSHA. So with that, let's maybe just kind of recap for us on the timeline on what's how this has come out, and maybe what we should expect for future changes, Mary.
Okay, so Mike, I do first want to start with telling everybody to think when we're going over this about the fact that this is a federal plan. So we will also talk about states that have already challenged this, but in every step of this plan, employers need to look at the local and state laws in where their offices are, because they may differ from the ETS. But the ETS did go into effect on November 5th. Unfortunately, the following day on November 6th, the Fifth Circuit Court of Appeals stayed the ETS. Now, so what does that mean for us non-legal people? What that means is, for now, it is in limbo. It is not, it may go forward exactly as planned. It may change slightly. Some of these timelines that we're going to talk about in a minute may change. But as we go through this, we still want everybody to be prepared. I really have no way of knowing whether it will go through exactly as we're going to discuss it today. But one thing I do know is that all employers need to be prepared, even those with less than 100 employees. So as written right now, the initial compliance deadline for testing is January 4th. And the initial compliance deadline is, and that should be January 4th, 2022. The initial compliance deadline for other provisions is December 5th. And generally, and we will talk about state plans later, but generally, if a state has their own state plan, they have 30 days to adopt the OSHA standard, or to adopt a standard at least as effective as the federal standard. So those are the basics that we know right now.
All right, so I think we will, when we wrap here, let's get through the detail, because there's so much to talk about. Whatever time we have left here, I kind of want to spend a little more time on this level of uncertainty and how small business and mid-sized companies should be thinking about how to operate in this I don't know, maybe feeling of ambiguity, right?
Yeah, sure.
Just because there's some ambiguity doesn't mean we can't act. So let's first understand what the requirements are as of today. Okay.
Perfect.
Yeah. All right. Let's just talk about overview. What are the big bullets in the guidance?
So it affects employers with 100 or more employees. And what they're asking is that employers ascertain vaccination status. So first off, that's one of the things that we want to start doing. Luckily, Assure Payroll has a system that you can record it right through the payroll system. Keep it confidential, because this is a medical record. So employers need to be very, very careful how they're ascertaining this and collecting those vaccination records. And you should start to create a policy. So right now, it would be very difficult to put that policy forward because the ETS is not finalized. But my advice, because those deadlines are quickly approaching, is to get that policy created, and that's part of the provisions. Another provision is that you need to provide information on false reports. There is whistleblower protections within this ETS. There's benefits of vaccination. So those things need to be in the policy, as well as informing your employees when they will get paid time off for vaccination and to recover. So the employee will get time off to get vaccinated, and that's up to 4 hours each time they get the vaccination, if it's a 2-shot deal like Moderna, and to recover. Here's where it gets a little bit gray, and here's where, the employers that we support, Mike, are really on the phone to us going, well, what happens if they get sick from the vaccination? How am I paying for that? So again, you have to look at state law. So New York does have something, so does California, that'll cover that illness. And if your state does not have it, it's going to be PTO time. But I will tell you now that we believe that if the employee is out of PTO time, I would discuss it with either your employment attorneys or the Assure HR consulting team that works with you to see whether you pay that employee further. This plan also includes the requirement that employees that are not fully vaccinated submit to weekly COVID testing and wear face covering. That to me is significant, and we'll get into that later. You know, the CDC has had lots of recommendations out there, but those were always recommendations, Mike. So the employers always had to interpret it. Now, if you're not fully vaccinated, it is part of this ETS that the employee needs to wear a face covering. And we'll get into that in greater detail later. It requires employees to give notice if they have COVID-19, and that the employer remove workers if they have COVID-19 until they meet specific criteria to return to work. Additionally, the employer will have to maintain records and report work-related COVID-19 deaths or hospitalizations, which is in keeping with OSHA requirements. Always, you know, employers that need to adhere to OSHA requirements have to record deaths and hospitalizations, but they put that in there just to remind employers that it is part of this ETS. So those are the basics.
So I'm going to hold off on asking questions because I know most of those bullets we're going to unpack in more detail in subsequent slides here. I think maybe one way for companies to think about this is, you know, again, whether you love it or hate it, at least we have some more clarity, right? It was always up to the employer. You've always been, you've had to provide a safe work environment, right? So there's always been OSHA requirements that everyone had to comply with. And then there's CDC guidance. Well, those CDC and OSHA are two completely different organizations, right? And so
right.
At least even outside the context of the vaccine mandate from the Biden administration, at least there is finally clarity from OSHA on what that means in relation to COVID. Is that probably a healthy way to think about this?
It is. I think that is a great way to look at it. OSHA is always looking to keep a safe environment for the employees. So now they've stepped in and addressed this, you know, emergency, this pandemic, and how employers can go even further to protect their employees.
Yeah, right. Okay, very good. Okay, let's start unpacking some of the details that you just kind of laid out in that overview.
Absolutely. So employers are covered if they have 100 or more employees. And we are getting a lot of calls from our clients saying, well, how do I count that 100 employees? So the confusing fact is that you're going to include workers that aren't included in the mandate, and that would be remote workers. So if your company ABC and you have 100 employees, and that will include your full-time employees and your part-time employees counted each as a head, right? It will also include your remote workers, even if those remote workers, because they're remote, are not applicable. This ETS is not applicable to them. You will not include independent contractors, and there is some exclusions, right? Because the federal contractor Safer Federal Workplace Task Force guidance covers federal contractors, which have their own regulations, which already came into effect before this. And so did the healthcare, OSHA's healthcare ETS is a little bit different. And so, but similar, right? And there are some employee exclusions, right? So workers who are remote, again, go into the count, but they do not have to get vaccinated if you're mandating the vaccine or tested, right? And workers who are exclusively working outdoors. So think landscapers. So if they're exclusively working outdoors, that employee is excluded from the ETS, but you count them when you're counting your 100 employees.
So Mary,
yeah,
Mary, if I've read it correctly, hours worked is not a consideration, right? So like,
correct.
which is just to make things more confusing, right? Because everything around the COVID laws and stimulus with PPP
Right,
loans,
right.
you're trying to calculate, how many
Yeah,
employees do you qualify, don't you qualify, ERTC, et cetera. That kind of backed into the same logic as like the Affordable Care Act,
right.
where full-time equivalency. This doesn't matter how many hours someone work. It's just is it a human being on staff based in those different roles, right?
Correct. And I would just advise employers, that if you're like, applauding that you did that employee count and it came to 98, but you usually go to 100, I would follow the ETS, because at any point in the next year, right? Or, and we're not certain if it's the foreseeable future yet, right? But in the next year, if you hit that 100 employee count, you're covered, right? If 5 people leave, right, based on your last, webinar, we know we're in the Great Recession, and, we're losing employees. There's certainly a lot of turnover for most employers. The employer can't contract around the law. And so what I mean by that is you hit that 100 mark, you're eligible, right? Just like we would do for FMLA. If you're 50 employees normally, but 5 people quit, you don't stop offering FMLA. And, part of the reason that I encourage employers to be very careful and not try to be, skirt around this, is because these fines are huge, and they are considering increasing the fines, right? So they're over $13,000 per violation. And if they're willful, they're over $136 per violation. And we're not certain, how they're going to be auditing this, et cetera. But don't forget, you could have an employee feel unsafe and make a complaint. Well, then they're definitely coming in and auditing your office. So I just encourage employers to be careful. We're here to help, when it comes to counting. The other thing that you want to consider is that if you have 2 related entities, right? So you have a manufacturing office in one locality, and then you have your offices in a separate building. Those are related entities, and you will count them together, okay? But separately, let's just say that you use a temporary staffing agency to fill some of your positions, and you have maybe 10 of those in your building. Those employees can't be counted twice, right? So the temporary staffing agency should be counting them in their employee count, Mike, not the host employer. So it does get confusing. For absolutely, you really need to dig in and look at this. And I invite everybody to get guidance. We are always here to assist through all of this. COVID has made HR very interesting, and all of our HR consultants very busy.
Yeah, right. I mean, so it's interesting that you talked about, hey, if you're normally 101 employees, you lose 5. So now you're 96 employees. That doesn't leave you off the hook. The inverse is also true, right? I mean, if you hover at 95 and you hire 6, that puts you over the limit.
Yeah.
I think our guidance to growing companies would be this: err on the side of following the law if you're even close. Because to your point, Mary, all it takes is one employee to say, hey, I don't feel safe. You're gonna get investigated. And all of this is self-evident on 941 quarterly tax returns. It's very evident just by looking at payroll check history. You can tell exactly how many. So regardless of whether somebody only worked 5 hours one week, I won't count them. Well, no, because you're gonna have an audit trail that shows they got paid and you paid taxes on that day that you can't hide. So don't try, right?
Right. just like any other law, you cannot contract around the law. You need to follow it to be compliant.
Yeah. All right. So how we count employees is different than what we did ERTC and PPP, but kind of beneficial ownership. If you own more than 51% of two companies, though they get counted together as related entities. So
Correct.
some things are the same as other COVID stuff, and some things are. Yeah. Anything else you want to talk about coverage before we move on to state law issues, Mary?
No, I think we covered that, but again, I know there's a lot of employers that may be listening that need some guidance, and we're here to give it.
Yeah, very good. All right, let's talk, unpack the state laws, and boy, this could be a whole webinar series in and of itself, but what are the big points here?
So what OSHA's position is on this is that any state that restricts vaccination testing or masking, those restrictions are going to be preempted by the ETS. Now, of course, that's why right now there's a stay, because some of those states are, taking legal action. And just this morning, I will say that also there's a couple of unions that are in the courts also trying to fight these regulations. So, we will be here again, Mike and I, updating you, because there definitely will be updates. But right now, some of the states that have potential conflicts are Alabama, Arkansas, Montana, Texas, West Virginia, and Iowa. So those are the states so far, but there are other states that are coming forward pretty quickly. And so it's in the Fifth Court, the Fifth Circuit, because they combined some of the complaints that came forward that were filed. And so the basis is that, again, OSHA is saying, okay, you have a state plan, that's great, but you've got 30 days to adopt the ETS or something that is stricter, or follows it but stricter, or you can jeopardize the fact that you have a state plan. So again, a lot to be seen. I think in the courts, I think you're going to see a lot more court action coming forward. So where this lands, we're not sure, but we will definitely be here to guide our employers through this, because it is ever changing, just like many employment laws.
Yeah, and again, we've given this type of guidance before, but I couldn't emphasize this enough. Our advice, whether you love or hate these regulations, stimulus plans, mandates, doesn't matter. You have to follow the law. And so it gets really confusing when laws contradict each other. And so our guidance would be to follow the highest law that keeps people the safest. That's how you will be kept safest. So for example, if this federal mandate says, hey, if you're not vaccinated, you got to wear masks, you got to provide proof of negative test every week, but your local county health executive says, no, that's not necessary. Your state, the governor says, hey, you're protected here, you don't have to follow that. I mean, that's kind of bonkers to me. I mean, that now it is possible that the the strictest law will not enforce that law. So because you could have the opposite, right? You could have no federal mandate, but you could have a mayor that implements very extreme mandates, right? That local authority can still crack down on you regardless of what federal law says, and vice versa. So just follow the ones that keep your employees the safest, and you can't hardly get in trouble. Am I thinking about that right, Mary?
Absolutely. Anytime there's an employment law, whatever favors the employee the most is the law you'll follow, right? And so if, just like you said, if state law is less restrictive, and you may look at it like less protective, or that's the way OSHA would look at it, you're going to have to follow the federal law. And they're coming right out and saying, you know, we are preempting state laws. State laws have to follow these requirements as well. And that's why they're in the Fifth Circuit Court kind of fighting it out. But, you know, we'll see where this lands.
Yeah, just don't sit on the sidelines not following the law while the states in the Fed duke it out together. Better safe than sorry. Okay, let's talk about policy information requirements.
So part of the ETS, Mike, is that employers will need to create a policy. So that policy, in my opinion, you should start creating for your organization. It must include the requirements for the COVID-19 vaccination and exclusions if applicable, right? So your remote workers, as we said, have an exclusion. Your outdoor employees have an exclusion as well. So it should include that. It should include information about testing and the face covering requirements. And when we talk about face covering requirements, of course, there is some information included in the ETS, what kind of face covering, just like the CDC has been telling us for a year and a half, right? A bandana doesn't count. I think that now everybody has face coverings. Interestingly enough, at one point, employers were responsible to provide this protective gear, and this is saying employees can provide this face covering themselves. But if I was an employer, obviously, I'd make those masks available so that if somebody comes in with a face covering that is not, a bandana, using my example, that you have a mask available and the employee doesn't have to go all the way home. And this is for unvaccinated workers. And I would also say, and we recommend it for other employees if you really want to be even safer, right? So again, this policy, there's certain requirements in the policy, but there is certain customization that an employer can have, and it needs to be clear to your employees. The employee communication, Mike, is one of the most important things in any time frame for an employer to keep engaged, productive, and quite frankly, happy employees. But during this past year and a half, during this pandemic, communication is even more important, because now we're talking about people feeling safe, but there's also things are changing all the time, right? At one point, I think all of us were like, oh, the pandemic's over. And all the masks came off, and here we are again, right? So communicating to your employees is very, very, very important. This policy should also have information about vaccination status. So how are you going to collect the information within your organization? Who are they giving that information to? Again, just a reminder that that is medical information, so you have to make sure that it is kept confidential. So you don't want people standing in line handing their card to you, Mike. You need to set up a procedure. It needs to also talk about the paid time and sick time for the vaccination. So as I said before, this policy is giving employees 4 hours for each time they get a vaccination. Now, remember that they don't get 4 hours like given back to them if they went and got the vaccination on a Saturday, right? So I've had that question before, oh, my employee got their vaccination on Saturday. Do I have to give them 4 hours off on Monday? No. So a lot of this, you need interpretation, and you also need to take a deep dive into what's going to happen if they get sick from the vaccination, and or if they, again, what happens when they have COVID, and how are you paying for that time off, what happens with a notification? How are they notifying you if they have a positive COVID-19 test? I've always said that the winter, and we went through one winter in the pandemic already, Mike, but the winter's very challenging, right? Every time somebody sneezes in the office, you're like, you know, you really run. Before we were like, let's tough it out. But you really want to make sure that employees are being uber sensitive to when they're sick, when they see signs of COVID-19, that they're going and getting tested, and informing the employer quickly, and being removed from the office. I had an employer call me the other day and say, oh my gosh, what do I do? Joe in manufacturing just called and said he had to get a test for COVID because he was traveling abroad, and it came back positive. And I said, you remove him from the workplace immediately. Don't stop it, go. Just go home. So I was surprised when I got that question, Mike, but this is making it very clear. And employers, that's why you have a policy like this, right? So employees are informed that if you get a call like that, you leave and then call me from your car or home that you got that positive test. And the employer will walk them through, when they come back, what are the requirements of coming back, et cetera, right? There also in the policy needs to be information about whistleblower protections, that if you know that somebody did something unsafe in the workplace concerning COVID, that and one employee has a whistleblower protection to come to human resources or management and talk about that. And it also provides, this policy should provide information about people giving false information, either false positives so they can stay home, or giving false information about being vaccinated. So I do hear that there are already fake vaccination cards out there. So employers need to be aware of that, but I also want to caution employers not to, be a detective. So if you get this card and it looks like all the other cards, you're going to accept it, to start questioning your employees. You could skate on dangerous ground.
Mary, I got a question. So I've been at, I have been asked, we have been asked many times. I think there's lack of clarity around what is, HIPAA data, what is not, right? Because on one hand, somebody shows symptoms, or an employee tells you that they tested positive, they have to be removed, and it's by law, right? But some employees may say, hey, whether I tested positive or not, that's none of your business, employer. That's private health information. But that's not true. But yet at the same time, the details of someone's vaccination card, the dates, times, specific medicine, that certainly is HIPAA protected data. Where the lines, can you help people understand where the lines kind of start and stop of what is and is not protected, and that they have to treat as such?
So the EEOC and the DOL have come out and said this is not HIPAA protected, and that is clear. They have been clear all along that this is not HIPAA protected. But some additional guidance did come out, sort of on the same vein, in that there is now, the EEOC now has come out and said that long COVID is what they're calling it. So effects from COVID that linger, and we've had many employers with employees that have this, may be considered a disability. So that will be protected under the Americans with Disabilities Act. But this can't be HIPAA protected, right? Because there's contact tracing. So that you don't give the name. I don't say Mike tested positive for COVID, and I go to the people around that work around you, but Mike needs to tell me that he tested positive because I need to go to those employees and say, you were in close contact with somebody who was positive. We recommend that you go and get tested. So the guidance is very clear on that. That's one thing that's clear. And will it become gray at some point? It may. And we still always have to be careful. It is clear that testing information and the vaccination status are protected. They are confidential. Again, we're not telling employees who tested positive, but the employee who tested positive does need to tell us. And it's even clearer in this ETS. Excuse me.
And I think, and so that sounds all fine and good, but if everybody in the office knows who it was, right? So I think our guidance here would be treat employees with as much respect and privacy as possible, knowing this isn't HIPAA protected data, but you still have to follow the law of not allowing them in the workplace. So they might be upset saying, hey, I don't want to tell you my status and whether I'm positive or whatnot, because that's protected. It puts you in the middle. So all you can do is follow the law. They can't come to work, but just treat them with as much respect and privacy as possible, even though probably everybody else in the office knows, because they know who the one person who's not at work that day. Is that right? A fair way to look at it?
Yeah, absolutely. But I just, again, have to caution employers that if somebody goes, oh, Mary, I know it's Mike that has COVID, he's not here. You don't confirm it.
Right.
You still can't confirm it, right? So, and the fact of the matter is the employee is usually texting their coworkers and saying, oh my gosh, you won't believe I have COVID, but still human resources or management, you still can't confirm, that information because it's protected. And so just to finish with the policy requirements, there should be deadlines, right, for the actions that need to be taken. There should be a scope of coverage. There should be how the policy applies to new hires, and of course, procedures for compliance and enforcement. So you can take disciplinary action if you confirm that somebody gave you false information, and that includes up to and including termination of employment if somebody gives you false information. And I think it's always important in a policy, we write a lot of handbooks, that you have consequences. So that's pretty much the policy that you'll have to write. And so I encourage employers to start this process. We've already started writing these policies for our employers so that they are ready. And if there needs to be slight edits when the ETS is finalized, it'll be much easier to do.
Yeah, right. Okay, I'll have some comments on that when we wrap here. So how do employers actually go about determining the vaccination status?
So what they're going to have to do is have information for every employee, their vaccination status, right? So, and if you already got the vaccination status prior to November 5th for, Mike and Mary, then you don't need to go back to Mike and Mary and verify that. You've already gotten that vaccination status. So this is something, Mike, that I really think employers should be doing that are 100+ employees, of course, should really start doing now, because this is time consuming. And I think it will also help them decide, am I going to mandate vaccines, or am I going to allow for the testing / masking option? The other thing that this vaccination information sheet should include, of course, is who's fully vaccinated, who's partially vaccinated, who's not vaccinated for medical or religious accommodations, as well as not fully vaccinated. You're not considering them fully vaccinated because they didn't give you acceptable proof. So this is something we recommend that you start doing now. Again, it's just time consuming, how you're going to do this, and it's going to take some logistics, right? So depending on your particular organization, this may take, a lot longer than you think.
Yeah, this just screams you need a payroll HR system to actually handle all this electronically in a touchless
Definitely.
way, right? Yeah.
Definitely. And so, the first thing I do when I hear about these things is, I talk to our, payroll experts at Assure and I say, hey, how are we going to record this? And they walk me through it. And I think the system is very intuitive and easy to keep it. But employers, again, should start looking at that already, right? How they're going to store it.
Yeah, right.
And get the information.
Anything else on determining status before we talk about testing data or details?
You do also, when it comes to the documentation and the way you collect it, I was a little surprised that they're being, I think, pretty reasonable. They're giving a lot of options to prove that you've been vaccinated. So you could either have something from a healthcare provider or a pharmacy that's a record of it. You could have that US COVID vaccine card, the picture that you have on the first couple of slides. You could have medical records documenting the vaccination. And by the way, we have had a lot of questions, Mike, about, well, I had COVID, so I have the antibodies. That is not going to meet these requirements. You have to have the vaccination to meet the requirements. You also could have, record from public health state or tribal immunization information system. And then they are also allowing for any other official documentation that contains the type of vaccination that you got and who administered it. So that's the one that is a little open to interpretation, but it's pretty clear the documentation should say whether or not you're fully or partially vaccinated.
Yeah, very good. There's plenty of employers who have been leaning in hard on this topic and been trying to get a fully vaccinated workforce or requiring it long before it was mandated. There's other companies who kind of take a very opposite position on this. I think the message is get documentation of any kind, right? As long as you are demonstrating that you are getting documentation, regardless of what that looks like, you're simply following the law. So, okay.
Correct.
All right. I'm looking at the clock, and there's so much meat here, Mary, but I'm probably going to accelerate. Let's talk about testing details.
So the testing, this is interesting because this is like one of our biggest questions, right? When this first came out. And what they're saying is workers who report to the workplace, the employees who need to be tested at least once per week within 7 days of reporting to work. So that's very helpful, I think. And so that will allow employers to start thinking about how they're going to do it. Are they going to let employees do it, on a Sunday before they report on a Monday? Are they going to have a third party come in and do it in-house? And there's a whole lot of restrictions around that. So this is definitely something that needs a lot of consideration. And the other thing is that what we need to think about is even for those remote workers, right? So you and I work remote to a large extent, but right now you're in the office. So you have to think about those employees. When they come into the office, if they're not vaccinated, they're going to have to be tested within 7 days of coming to the office for a big meeting, et cetera. So these are the things employers have to start thinking about.
Anything else on testing? I know there's a big topic.
Like you said, we're going to go into greater detail and we could go on for days, but those are really the high points of the test and how that test is going to be done. And don't forget that we're still thinking about reasonable accommodations for the vaccine, but there may be some reasonable accommodations for certain testing due to disability or religious reasons. So that's something new that's come up. the cost for the testing. Right now, it's saying that they're not requiring employers, but again, what does your state law say?
Yeah.
And when it comes to the time that the employees take for getting tested, well, that's also up in the air. So right now, the DOL is saying employees need to go do that, but the other piece of it is the state laws, right? So how do the state laws preempt that? Again, employees get the better of the two. So the testing details are very explicit in one vein, but we still need to take a deeper dive because it's going to differ for each state.
Yeah. Okay. Let's talk about a fun topic that is not polarizing in our society at all. Face coverings. What does OSHA say that the rules employers must follow here?
Yeah. So this is pretty consistent with the CDC, and we won't take much time on this one because it's the same requirement that we've always had, and there is exceptions, right? So if you're in an office that has floor to ceiling walls and a closed door, you can take your mask off. Same with when you're eating or drinking, right? And if you had a respirator on or a face mask, you know, there's some exceptions. So there definitely is some verbiage around the face covering. It has to cover the nose and the mouth, just like we've always said. So the face covering is pretty consistent with what the CDC has been saying all along.
Yeah, the way I look at this one is almost like a gift, right? That if you're hardcore in favor of this, great, more validation. If you are anti, at least we finally have legal clarification from the organization who has teeth into work safety. That's OSHA, right? So there's no ambiguity of what does OSHA say versus CDC, which has no teeth to administer and punish if you don't follow guidance. So at least this gets everybody on the same page and we're clear legally. So. Okay, next topic. How the heck do we handle employee removal? And I think this is really in the context of non-compliance, right?
Yeah, so the removal from the workplace is, again, pretty consistent with what the CDC has been saying. So whether or not the employee is vaccinated or not, when they test positive for COVID-19, they need to be removed from the workplace. And the employee will only be able to come back when they receive a negative result on a nuclear acid amplification test. So that's the NAAT, right? So they're being very, very specific, which is nice, right? So it gives us some guidelines. And so we have to be really careful that we have this information. There also should be a recommendation from a healthcare provider saying that they can return to the workplace. Now, there definitely is still some questions around some of this because employees can test positive for a long period of time after they have COVID-19. And so there does need to be some more clarification on this. But the clear facts are that vaccinated or not, if you test positive for COVID, you are removed. You need to be removed immediately from the workplace.
Yeah, this is fairly black and white. And again, almost view this as a gift. At least we have good legal clarification from OSHA, not just recommendations from CDC. So let's talk about paid vaccination leave. You touched on this earlier in our conversation here, but what is the law saying about this now?
Yeah, so I think just to be clearer on this, employers have to provide 4 hours per vaccination, right? So if you're getting the Moderna, it's in 2 steps. So each time up to 4 hours, right? So if it only takes them an hour to go get vaccinated and then come into work, then they come back to work. And like I said before, it's just 1 hour of paid leave, right? Just make sure that as an employer over 100 employees, you are not making them take that out of their PTO bank. This is over and above their PTO bank, okay? Now, employers also should be giving up to 2 days to recover from a dose, right? If somebody is ill from getting the vaccine, they should provide up to 2 days. And again, it needs interpretation if the person is sick longer than 2 days from the vaccination. But this can come out of either a sick leave, if there's a state sick leave that this applies to, or the employee's PTO. But as I said before, if their PTO has run out already, I mean, we're at the end of the year, right? So some employees might not have any time off left. My advice is to give them the time off paid. But again, we're here for consultation.
And Mary, so it's paid, it's not just leave, you have to pay them for that leave. So you're out of pocket. What, if any, compensation as employer do you get? Last year we had FFCRA, this year we had ARPA.
Where you got the tax reimbursement. They are not talking about any type of reimbursement right now for that time off back to the employer. Maybe that'll come down the pike once, all these legal situations settle. But right now that is out of pocket for those employers.
Yeah, so to be clear, it's not the smallest of employers, it's over 100 employees. But as of today, there's no FFCRA, there's no ARPA, there's no get the money back, claim it as a tax credit. This is to be paid by the employer.
Correct. That being said, there are a few states that do have some laws in place that will probably cover the employee going for vaccination. So once again, this is federal. You need to look at your state laws as well.
Yeah, okay, very good. And I think my sense is this is not a giant problem budgetary wise for most companies, but we need to be eyes wide open. Obviously, some employees are going to have a stronger reaction than others and need more time. Huge percent of people come right back to work and it's zero impact. But at least be informed of what the obligation is.
Right.
All right. What is the obligation for reporting and record keeping on all this stuff?
Yeah, I know. And so the test results, vaccination records, and that whole list of who's vaccinated and who's not that we went over should be kept for the life of the standard, right? But OSHA is usually like 30 years, right? And you don't have to keep it that long. But for now, they're just saying for the life of this standard. And, right now we don't know how long that's going to be. And of course, you have to keep the record, as we said earlier, of deaths or hospitalizations. So that's probably the easiest part.
Yeah, and again, it's maybe a pitch for sure, but this just screams to have a payroll HR system in the cloud, touchless document storage for all your record keeping, right?
Absolutely.
Yeah. Okay. The last thing, and you kind of opened with some comments on this. I really want to drive this home of this whole thing about this is a temporarily stayed. Kind of reiterate if you could the legal definition of what that means. But most importantly, who cares about the legal speak, the jargon? What I just want to make it so clear to people that even though there's ambiguity, things will probably change. Of course, they're going to change. This pandemic isn't going to be here forever. It's going to, who knows what the ebbs and flows remain. But you have to follow the law as it states today, regardless of our assumptions of what may change in the future. Can you just speak a little more to that, Mary? Because I don't want any ambiguity in that topic.
Yeah. Absolutely, Mike. And as we said in the beginning, some of this will change. I mean, I think it would be very unusual with all of the lawsuits that are in the courts that this will stay exactly the same, right? So they may push out those dates, that December date and that January date a little bit, right? So that remains to be seen. And so right now, what that temporary stay means that, you know, if this continued through December, you wouldn't have to do anything by that December deadline because the ETS is in the courts right now in a stayed form, okay? But as we said before, I just want to finish with that I still encourage employers to create the policy as we stated here so that you're prepared. And again, you're not giving it out yet, but you are gathering that information, customizing it for your organization. Also start to make a plan for collecting that vaccination status, as well as the testing information, and have a policy on how is everybody supposed to get tested, when they get tested, what are the tests they should be taking, how they should report it to you. And the last thing, even though there's a temporary stay on this, I want everybody to start preparing for how you're going to react to accommodation requests for either religious or medical requests. So what we have done for employers is we have created forms. As soon as an employee says, I have a religious or a medical exemption so that I don't want to get vaccinated or I can't because of this exemption, they fill out that form. And then of course, as per the Americans with Disabilities Act, another federal law, that you enter into interactive dialogue with that employee to ascertain whether or not that accommodation is whether you need to make that accommodation or whether or not it is, a hardship for the organization. And again, I encourage employers to, utilize our guidance when you're getting through this. We already have a system in place to guide employers on how to get through those accommodations, because that's very important that that is done by the letter of the law, again, with respect and following the various laws, ADA, this ETS, there's a lot of laws that are going to come into play there.
Yeah. Mary, I really appreciate your time today. There's so much detail here, and so this session is recorded. It's going to be on demand for everybody to come back to and revisit and share with others. We're also producing an ebook that we're going to publish next week. I want to say this thing is approaching. I think we're approaching like 20 pages. This is an extremely comprehensive document where we lay out all the details of the mandates and our interpretation of the OSHA guidance that really could be a tremendous tool to all growing companies, regardless of size. Obviously, this most directly impacts the over 100s. But for all growing companies. And so with that, I just want to thank everybody for joining us. Of course, we'd love to be able to help in your payroll and HR needs. We have all of the tools that live in the cloud to store all these records and these documents to help you stay compliant from a technology standpoint. But I think maybe more importantly, the organization that Mary leads, where we provide outsourced human resources services. Human delivered services. And so whether you just simply need HR support for your managers to help them build better, stronger, more productive teams and be compliant in the process, maybe you want a little more strategic help for your managers and we can be that truly outsourced virtual fractional VP of HR, if you will, to provide all the strategic guidance, go beyond just simply compliance and answering your day-to-day questions, but kind of go on offense. How do you stay compliant, but also how do you build great teams, all the way up to a complete outsourced HR solution where we could literally be your HR department your frontline employees call with any of their employee relation questions or issues, so whether it's whistleblower or otherwise. And certainly in all of this, Mary talked an awful lot about the need for documentation and record keeping, and policy documents and handbooks. And I think about just, man, pre-pandemic, an employee handbook was a really important thing, and not easy because it's not just about the do's and don'ts of your workplace, but it really is the legal requirements. But the legal requirements in the last 2 years, obviously 18 months, has just been insane. How much change there is, how many new layering in of federal, state, and local regulations, sometimes conflicting with each other. Putting together a handbook is more complex than it's ever been, and this is what we're awesome at. So if there's any way we can help, Mary's team would love to help you put something like that together. So we'll pop a survey up here at the end of this session. If you'd like to learn more, just let us know, and someone will reach out with you. But until next time, until we release our ebook next week, Mary, thanks so much for joining me today. As always, I learned so much.
My pleasure.
And thanks everyone else for joining us today. Have a great day.